Hello, everyone. I'm just going to give it a few minutes for everyone to get out of the waiting room to the main room. Still coming in. Okay. Well, thank you all for attending NAPSA's Research to Practice webinar. I am Esther Thorpe, the Administrative Project Coordinator with NAPSA, and I'm happy to welcome you on today's webinar. For those of you who are not aware, this webinar has been organized by the Research to Practice Interest Group, which is often referred to as R2P. R2P is a network of researchers and practitioners across the country who all share an interest in advancing the field of APS and protective services. If you're interested in hearing more about the quarterly webinars or the work being done with ADDI, which stands for APS Administrative Data Initiative, or you'd love to have a space to connect with researchers and practitioners, we do have an R2P listserv that we encourage you to join. You can visit our website to learn more and get instructions on how to join the group. And I will also drop the link in the chat. And yeah, welcoming our presenters today, we have Angela Medina and Jason Burnett, and I will go ahead and hand it off to them shortly to introduce themselves. Just so everyone is aware, you all are currently muted, but after the presentation, we will have about 15 minutes or so for you all to ask your questions. And if you'd like, I can unmute you to ask your question that way. So yeah, and just so you know, this call will be recorded and will be posted on our website at napsa-nav.org. All right, I'll go ahead and pass it to our presenters to introduce themselves and get started.
Burnett, Associate Professor at the Government Medical School here in Houston, Texas. I run our Texas Elder Abuse Mistreatment Collaboratory. It's a partnership with a long-time partnership, probably 30 years or more, with Adult Protective Services out of Texas. So we do a lot of joint initiatives, and this is one of them that we're going to talk about today. But before we jump into the content, I'll go ahead and pass it over to Angela, who's my co-presenter. And Angela, would you go ahead and introduce yourself, please?
Sure. I'm Angela Medina. I worked with Adult Protective Services in Texas for about 25 years, up until I retired this past fall. And like Jason said, we worked on several initiatives together, including this one that we're about to present.
Cool. Thank you, Angela. Yeah, so when we got asked to do this presentation, I was like, I know Angela's retired, but we're gonna help her fail at retirement and bring her back. So thank you, Angela, for being willing to come in and be part of this presentation and give the APS perspectives. It's really important. We can always talk about sort of programs we want to do, to enhance the lives of older adults and those sort of things. But with programs like what we're going to talk about, having APS be part of that and be central to that is absolutely critical. And it took APS and Angela and her team to really be part of every step of this so that we could pull this off. And so I look forward to hearing questions from everyone at the end. If you have questions, you can pop them into the chat, or just wait to the end. You can ask us. Hopefully we have enough time to get to all those. But let's go ahead and jump into the content. And so what we're presenting on today is a program that we built here in Texas, and it was funded by the Department of Health and Human Services, the Administration on Community Living. And it seems like so long ago that we were working on this. We put in the first application, had some flaws, and then we finally got it funded. And it took a while to get this program going. I think you'll understand why, because it became quite a big program. Because as we know, financial exploitation, it's a big thing, right? We're all dealing with it on some level or another. And Adult Protective Services deals with a lot, and with these sort of cases, they're pretty difficult, right? Probably some of the most difficult outside of just sort of your really bad self-neglect cases. And so we wanted to try to figure out ways to enhance adult protective services, the way they do their financial exploitation cases, ways to bring in extra resources for them so that they can work these cases in a way that they felt good about and achieved, potentially better outcomes. And so what we did is we put together this nice program that we'll talk about here throughout the next hour. And we've already gone through, our introductions. In terms of learning objectives, we're not gonna, we're just gonna we want you to leave here, understand the purpose and the major goals of our program, describe the process and the progress towards each goal. So we'll go through two of the major goals and talk about the process for getting there, and we'll describe another goal that we weren't able to quite get there to, because the program just kind of morphed into something a little bigger than what we had expected. And that's sort of par for the course when you're trying to tackle a giant, which is financial exploitation. And so we'll talk about the other third goal and how we're moving towards it now in just a little different way. We haven't forgotten about it, so we're starting to move towards it, but on a with some different funding. And then we'll also describe some of the preliminary findings from what we've done and what those implications are for the state of Texas, but also potentially for anybody on this call that wants to put together a program like this. I don't think it's any news to anybody on here. If it is, then welcome to the team. Financial exploitation is a big problem. It costs a lot of money, but outside of money, it also costs a lot of problems for people's health. Right? I mean, their social lives, when people are losing their life savings, and even if it's not a life savings, if it's losing $100 at an $800 a month income, that's a problem. Maybe they're not able to do the things they enjoy doing. Maybe they get decreased quality of life. We know it's related to mortality, suicide, emergency department visits. So financial exploitation has some real, real ramifications for older adults in our country and in the state of Texas. And the state of Texas does quite a few of these investigations each year. When we started doing this, hold on for 1 second. I got a camera that's doing its own thing here. Give me 2 seconds. Sorry about that. So the state of Texas, they do a lot of these investigations. You get a lot of allegations. And these tend to be some of the most difficult cases that they work, because they get very complex. You got a lot of moving parts. You got to figure out, is exploitation happening? Is the person, complicit with it? Did they say yes? And then there's hidden accounts, all these sort of things. And so it gets pretty complicated, and you throw in sort of the characteristics of the, some of the older adults, maybe there's cognitive issues, but it leads to, these difficult cases leads to problems with making, making a determination on these. And it's not because, APS caseworkers, anybody's, they're inadequate at what they're doing. It's just that these are super complex cases. And we find out that a larger, a substantial percentage of them go unable to determine. That drew us to want to say, okay, how can we potentially address this? How can we knock down that unable to determine and try to figure out, is this happening? Is it not happening? And so that's one of the major goals of this program that we built. But some of the other project goals is, to improve financial exploitation investigations, the knowledge and data collection. We know from hearing from our caseworkers, but also reading, the literature, specifically stuff by, Dr. Shelley Jackson, who's shown that, APS caseworkers, they say, look, we want to work these cases, but they're so difficult, and we don't ever see anything super positive come out. And I don't say ever, but it's limited when something super positive happens, that it comes back to the workers. They get sort of, deflated in working these cases because they are complex and may not see those outcomes. So we were trying to improve data collection, improve sort of how things are reported, improve their knowledge. They feel more confident in actually doing these investigations. Then we also wanted to create a pathway for financial exploitation expert consultation. So we wanted to bring some resources, specifically forensic accountants, to APS caseworkers to work those cases along with them, to see if they work them together, do caseworkers feel good about it? Do they feel like, okay, now I've got this additional support that I wanted and needed, and then does that lead to different outcomes in terms, for these cases? And then the final thing that we didn't get a chance to really tackle was to improve the data. We wanted to understand, can we improve the data we send over to law enforcement? Because all these cases get sent to law enforcement, but doesn't always mean that something's going to happen on that end. And that does, that's not speaking critical of law enforcement. That's just the nature of it. They got a lot of stuff going on too. And so we were trying to figure out, can we present these data to law enforcement in a way that maybe hits the radar a little bit more, or gives them what they need in order to make decisions on open investigations either sooner rather than later, that sort of thing. Just try to help move these along. And so we'll talk about that a little bit as well. But in terms of the project, we won't go through this painstakingly. But with any big project like this, you want to have sort of a logic model, give you a path of where you're headed. And so, if you look along this left side where it says inputs, those are all the things that sort of were critical for inputs to make this sort of thing happen. Like we had to find forensic accountants. I met I met Jason Olson at a conference years and years ago from Ide Bailey, and I talked to him about this idea, and oh yeah, we're on board. So we got Ide Bailey on board. Those are our forensic accountants. We have UT Health, Tarrant County DA's office, but all of us were working towards these really big three main activities, which was to use forensic accountants to do a needs and gaps assessment of APS financial exploitation training. We wanted to give them that training so they could look at it and go, all right, from a forensic accounting perspective, here are things that we think are good. Here are things where we could potentially improve. And here's some things that are just maybe missing that we think are really important for training and preparing your workers to collect good data and just do more comprehensive investigations of these. And then the other main activity was to do that collaborative case investigation, put forensic accountants with APS caseworkers, work in these cases so we can figure out, is this a doable thing? Does it work? Do they get along? Do they have, are there any bumps and bruises, any challenges to that? And then what are the sort of the outcomes of it? And then the last thing was to do the case evidence reviews by DAs and law enforcement offices to get them to take a look at our data that we're sending over and say, hey, we think this is better or not better than what the standard was. And once again, we didn't get to that third activity, but we'll talk about that a little bit. And in terms of these outputs, what we really wanted from the forensic accountants when they reviewed or they reviewed APS's curriculum was we wanted to see if we could provide an enhanced curriculum. Like, are there things we could add to it that made that curriculum more enhanced for financial exploitation? We wanted to do more comprehensive investigations of financial exploitation. We wanted to enhance the evidence and documenting of FE, so give caseworkers a more of a format to document these things, and then develop that standard protocol for DA and law enforcement. And as we move across this sort of logic model, we got to some basic outcomes that we wanted to hit in terms of the short-term outcomes with APS caseworkers. We just wanted to make them feel more knowledgeable, have more, feel like they had more skills and better outcome expectations, like just build the confidence of them to do these investigations, because they are super complex and they can wear you down. I mean, we've seen it. And then in terms of changing, the sort of intermediate outcomes, we wanted to improve financial exploitation case reading scores at the the state level, where you look at the cases, you read them, and go, okay, I think this including the right, a rich amount of information about financial exploitation. We wanted to include the better evidence sent to DAs, like we talked about. But two of the things that we'll really focus on here is were we able to decrease the unable to determine classification? So when we do this collaborative case work with forensic accountants, did that lead to workers feeling like, okay, now I can make a decision one way or the other, it's happening or it's not happening? We wanted to take a look at that. They also wanted to do, make sure that everyone that was working in this collaboration was satisfied with the collaboration, because that's super important. It's never going to work if you got one group going, I hate this collaboration, another one going, oh, I really love it, right? So we wanted to make sure everybody was on the same team and happy. And then finally, our long-term thing would be to reduce recidivism. And then, when appropriate, right, get more charges filed by the DA. That's not always the outcome we're looking for. We're not always looking for prosecution, but when it does need to happen and we can get restitution, that sort of thing, we wanted to see if we could move that sort of thing. In terms of the gaps assessment, that first big activity, we wanted Ide Bailey to review APS financial exploitation training. We also did a survey of APS staff. So in conjunction with what the forensic accountants noticed in the training and their suggestions, we asked APS staff, mainly caseworkers, hey, what is it that you might want to see? How do you feel about the training you receive on financial exploitation? And one great thing about working with Texas APS that I've learned over the years is you can ask these questions and you can get the information. I can come here and I can present this information. And when I present it, it's not, Texas APS doesn't look at it and go, oh, well, you're showing our weaknesses, because that's not what this was about. It wasn't about finding weaknesses in what APS does and how they do it. It's just looking for opportunities to make the training better so that the clients can be served better. And that's what APS is all about. So if we're willing to do that, they say, hey, let's do it, let's figure it out, because we want to address it. And so that's what we were able to do with this. And then what we did is we reviewed the survey results and I Bailey suggestions on what they found in the curriculum. And then we collaborated to finalize new training modules, to develop new training that could potentially enhance the data collection that APS was doing out there in some of the reporting. And so with Adult Protective Services, they have the financial exploitation training that's included as part of the APS instructor skills development. So they have the mandatory training that's around the state that they use. Now, in terms of skills development, when we did our assessment of APS workers across the state, one thing we wanted to do, we wanted to make sure we were getting people who had worked financial exploitation cases, right? We wanted to get feedback from people that had worked these cases so we could understand how to improve it. So we asked them things like, how many reports have you worked? How many cases would you say you've investigated? In terms of preparation for investigating, we wanted to compare financial exploitation, their perspective on being prepared from the training for financial exploitation cases versus other types of abuse, because we wanted to show, we wanted to know, is it different? Do they feel more prepared to investigate emotional, verbal, physical and sexual versus financial? Because that starts telling us the story. We ask them if they were prepared to investigate neglect, those sort of things. We also ask them why they may not feel prepared. So if they didn't feel prepared, why did they not feel prepared? Right? That's important. We ask them for recommendations for improving, right? So they've been through the training. What would they recommend that we improve? And then in terms of how would they like new training to be delivered to them? All these things are really important. We get them to engage. But then we also ask them, would they want to be trained on maybe some Microsoft Excel, just some basic things to help them with the data that they're pulling from bank records and all these things. And then we also ask them about some software, like would they be willing to use things like, ScanWriter and those sort of things. And that gave us some information, right, to go off with, to start building new training modules. And if you see, we had about 180 caseworkers. So they made up the most in terms of how long they said it took to document financial exploitation cases, 1 to 5 hours. That most people said that. A lot of people said 6 to 10 hours, some 11+ hours. So it's labor intensive. It's not a one-off. Hey, I went and asked them some questions. Let me document and I'm out. It's taken some time. And then in terms of they've worked quite a few cases, as you see, number 4 here. During the time with APS, when you say you have investigated, most of them said many allegations of APS of financial exploitation. And then the in terms of being prepared for investigating cases of like emotional, verbal, physical, and sexual, you see more of the workers saying, I feel like I am prepared for that. Same thing, when it comes to neglect. But then when you get to the financial exploitation, you see a little bit of a change where you're seeing more along the neutral, somewhat disagree, strongly disagree. And that just speaks to the complexity of these cases. That's what that is. And when you start asking them, if you answer, why do you feel like you may not be prepared? Some of the things they say is not enough time has been spent on exploitation training. I mean, all of this we have to balance, right? Any training you're doing within APS, you've got to balance with all the other types of abuse. You can't just be like, hey, we're just going to focus on one type, but you also can't keep people in training forever, and you can't cover every scenario. But what we found is that they would like to have a little bit more time spent on exploitation training. They felt like they needed, they didn't have enough time spent on how to read financial statements. I mean, that's complicated, right? I mean, you send medical statements to somebody, it's a bunch of information. How do we go through it? How do we make sense of it? They wanted to have a little bit more training there. And so we got to see that they had some specific training needs that they wanted. And some of those are like they wanted to identify lack of patterns, they wanted to identify the difference between exploitation and theft. How do they do that? Because those are different. They want to know how to summarize statements, and these are things that forensic accountants do, right? So it made sense for us to have forensic accounting on board. They wanted to go over real cases or shadow other experienced caseworkers just to get that sort of training, separate, training directly focused on exploitation. So they wanted to get really honed in on that. So we were able to take all this into account. And then, some of them said they wanted Excel documentation. They wanted training on that as well. When it came to, providing financial exploitation related trainings or topics that you think would better prepare you for investigating, they want to know ways to document and review statements. Once again, it goes back to, hey, we get it, we can get all these documents, but how do we make sense of them? Right. And that means you need these other experts, especially for the more complicated cases. They wanted to get some training from experts. They wanted more training days. So all this sort of overlaps. But in terms of training, we also asked them, well, how do you want this training? And most of them said hands-on, in-person sort of classroom. And so we said, okay, we'll work on that for you. And then would you be interested in the short specialized training for Microsoft Excel? Vast majority said yes, and they would like some access to software that helps convert these sort of bank statements into Microsoft Excel format. That's, that's a very labor intensive thing to enter things into a spreadsheet. There are softwares that can help do that. So when we got to once Bailey took a look at the curriculum, they wanted to offer additional financial exploitation training, at least twice annually, that includes presentations by individuals such as forensic accountants, law enforcement, district attorneys, because that helps see the perspectives, that helps them understand what these other disciplines need to see or want to see, or how they look at these cases. They wanted to lengthen, the financial exploitation portion, which falls right in line with what the surveys came back and said. They wanted to create classes or reference guides to address some of these big things that workers also said is, we want to understand how to navigate wills, deeds, trust, probate records, those sort of things. And then they want to create Microsoft Excel training for staff. And so what we did is we got together, Bailey, UT Health, APS, and we said, all right, based on all this, let's develop some new training. Let's figure out how to roll this out to everyone in a way that everybody wants it. And so what we ended up doing is we created an introductory financial exploitation training for newer APS staff. And so, it wouldn't make sense to train, like it becomes really cumbersome to create a big, really intense training for everybody, right? And make them go through that multiple times a year. And it made more sense to actually create a more specialized training for the subject matter experts, right? Get them the more intensive training. That way, they're there to help guide these sort of these cases with the workers anyway. So when workers are out there, they can go to the SME, and the SME can work with them and say, hey, I've had this more intense training. Be sure to look for this, and they can work together on sort of, those investigations. And then what we also did is we, created an introductory Microsoft Excel training, introductory training on pivot tables, which is really nice. If you've ever used pivot tables, you probably won't go back to not using pivot tables for things, because it just makes things so much easier to make sense of. And then we also worked on getting scan writer for certain staff to be able to help with these records. And then with all this, we knew that we wanted to create a collaborative case investigation. So we worked out a way, a set of processes so that forensic accountants at Bailey and APS caseworkers could work these cases together in a way that made sense and that was efficient. And so I'm going to turn it over to Angela to talk about DFPS's approach and what we all came up with, and then we'll talk about implementation.
Thank you, Jason. Go ahead and go to the next slide. So as Jason had mentioned, APS here in Texas has done financial exploitation investigations for many, many years. It's probably actually closer to 30 years. And it's part of our statutory requirements that we refer any cases that might be a crime to law enforcement. So these cases were already going to law enforcement, but Texas being a large state and having a lot of different law enforcement entities, it's always a little different on how that referral happens, but they are always sent. So, so when it came to our financial exploitation cases, we were working on getting forensic accounting incorporated into that. And so what our staff were trained on was determining whether or not a referral was even appropriate to go. We set some criteria for doing that. Before a referral was made, they were also required to complete a financial exploitation investigative suite of tools, the FEIST. And once all that was done, then they were able to make the referral to Eide Bailly. So to get trained up on how to do this whole process, our APS state office staff worked with Eide Bailly to train our APS subject matter experts in financial exploitation on that referral process. We also have APS mentors who work closely with our caseworkers, especially the newer ones who only have a year or two of APS time. And so they would work with them on that process. And then also the SMEs would help caseworkers as well and train them on the process. So determining on whether a referral was appropriate. So we wanted to make sure that we were getting the most bang for our buck, so to say, with making a referral to the forensic accountants. So we discussed the different types of exploitation cases that came in and which ones we wanted to kind of hone in on. And so we came up with a list of general items, issues that may be involved in a case that we would say, okay, that looks like one that needs to be referred. So you could have something where there's a real complex account structure. Maybe the client has an account, but perpetrator and maybe others also are mixing in their own money. There's spending habits that we don't know about for the client versus the perpetrator versus anyone else who may be on the account. Or there could be more than one perpetrator, particularly when there's more than one person other than the client handling all these funds. So when we're looking at all that, we would also consider whether or not guardianship may need to be sought to help protect the client. And the worker would have to work with the subject matter expert to gather any documents that may be necessary for them to complete the FEIST and make a complete referral. Okay, so next slide. Okay, so the FEIST. The FEIST is a tool that has been around for quite a few years. It was originally developed by Weber CPA in conjunction with a federal grant that was done through the Administration for Community Living, and it was done in New York. The FEIST was then taken in by Texas, and we made a few little modifications to it to make it work for our program. And so our caseworkers would use this tool, the FEIST tool, as part of their investigation to guide on whether or not a referral may need to be completed. And when they fill that out, it would go as part of the referral. Okay, so the FEIST tool the way that we used it, it was divided into two phases. The first one was the initial inquiry and observation, and phase 2 was any additional investigation documentation. And both of those had to be completed before making or when making a referral to the accountants, but it could also be used in cases where the referral wasn't being made. So it could still be used as a tool outside of a referral to the forensic accountants. So phase 2 had 3 steps to it that would help guide the caseworker through thoroughly reviewing all the documentation evidence and noticing signs of potential exploitation. And so when they put that all together, that would be part of the referral packet that would be sent to the forensic accountants. And as you can see on the slides, we've got up that's showing you some of the different parts of the FEIST tool as we had them. So let me get right here. So on this first part, we have the summary referral form, and that includes some of the demographic information about the client, their names, date of birth, and also about the perpetrator. And then it would have a summary of any of the financial exploitation that was suspected. And then they would just complete that form as complete as possible. And they would respond yes or no or NA on any of the questions that were there. And then if they had any extra notes about something, maybe a client said something about somebody else who helps them with their finances who wasn't mentioned on bank records, they could include that in this information as well. Okay. And so on to step 2, this is the red flags checklist, and this is going to be based off of the questions that the caseworker would ask, as well as their observations asked of the client. So they would check any of the indicators that they identified during their investigation, and that would kind of give some context for the forensic accountants to do a more accurate analysis. And so that would get completed, and from there they would move on into step 2, but phase 2, which starts with step 3 that covers the client's income and expenses. And that's where they would provide the detailed information about the client's income and expenses. And then that kind of helps them also in determining whether their income is sufficient or if there's maybe mismanagement of funds or potential exploitation. Okay. Sorry about that, missing my slide. Okay, so for making that referral, once that FEIST is complete and all of the needed bank records and credit card statements, any other related information that needed to be included was collected, all of that information would be provided to the APS subject matter expert, and then they would send all of that over. So it would include that summary referral form, the completed FEIST, any of those records, and then the names for anyone who may be involved, and of course, any other relevant documentation. So if there was somebody who was a power of attorney, the power of attorney documentation could be sent over with it. So this is how they would send over a completed packet. Okay. As I just mentioned, there's lots of different types of supportive documentation that could be included in there. Mortgage information, insurance information, receipts, credit card statements. There's sometimes people have multiple accounts. They may have checking accounts and savings accounts, but they could also have annuities and other types of accounts set up, brokerage accounts. So anything that we could get the records for, that would be included in the packet. Okay. So to make the referral, we actually have a portal that would be used for uploading all of this documentation, and it's the Forensic Assessment Center Network, the FACN portal. We use it for another side of a program we work on with UT Health, but we had a specific side of it that was created for this project or this program. So the SME would upload all of that information into the portal, and from there, Bailey would be able to get all of that information and review it. And they would take that and review it over 28 calendar days or hopefully less. And then they would create a draft report based on the information that they reviewed. They would then upload that report into the portal, and that way the SME could review it and say whether or not they were good with that, and they would move on with it and get the final report from Eide Bailey, or they would send back any questions or comments that they had, and then Eide Bailey would review those and make any edits or changes before uploading that final for the APS worker to use. So that is the referral process. So I will now hand it back over to Jason to talk about the UT side.
Perfect. Thank you, Angela. So, with this, we wanted to make sure that everything was just sort of seamless. It flowed, because we were really just trying to understand the process, right? And so, UT Health served as a liaison between APS and Eide Bailey, not because they weren't talking to each other. It's just easier for APS to do what they needed to do, UT Health to take a look. Okay, is everything here before kicking it over to Eide Bailey? We thought that maybe what it would do would create less of a delay if things are missing, that sort of thing. So we just served as that sort of liaison. And then we had a FACN, FACN FA case coordinator. That was the research coordinator, program coordinator, and then we implemented a protocol as so I just mentioned, to make it as seamless as possible. And so just really quickly, it went from APS to UT Health and then to Eide Bailey. And then when Eide Bailey had any further questions, they would reach out to APS directly. And so, as Angela mentioned, what would happen is these SMEs would enter this referral into the system, and when referral is complete, UT Health would review the case. So we had a list of things that we looked for specifically, like the FEIST and other things, the minimum sort of documentation that had to be there before we could push it over to Eide Bailey. Now there may be additional like things that Angela talked about, maybe Social Security records, those sort of things that we may not have known about, but we had like I said, a certain set of things we looked for. When that was there, we would reach out to the worker or to the SME and say, hey, is this everything? Just as that last sort of step, they said yes, we push it over to Eide Bailey. Eide Bailey would start doing their examination, and then either they would just do their examination, finish it up, report it back through our portal, or they might do their investigation and identify something and go, oh, we need some more information. They put it on pause, and then try to get that additional information from APS before they complete the case. So in terms of our Forensic Assessment Center network, the way that we did this, we wanted to have we wanted things to be HIPAA compliant. We want to share information. And even though, Eide Bailey had their own portal, we needed, to have this sort of this liaison piece. We wanted to make sure data was protected at all times. So we just decided to build it out a little bit. Angela kind of spoke to that, built out a side of this FACN program just for the FAA. So workers were used to going into this program, clicking and entering data. We didn't change the pages that much. We changed some of the indicators on the pages, but for the most part, they go in, they click, hey, we want to submit a FAA case, what we called it. And they would just put it into the system. And the way it would work, they just put some basic information in on the client. That way we could have that sort of thing. And this is a made up case, by the way. But they also click on some of the potential risk factors. That just gives a little bit more information. Okay, this person may have Alzheimer's, dementia, cognitive decline. They click financial exploitation, make sure that's appropriate referral. And this is just sort of where they would enter their attachments. They would put the combined records. So if that could be all those things that Angela mentioned, Social Security, utility bills, all that sort of stuff. They put the de-identified intake report in there as well as the FEIST tool. And then for the examiner report down here, this was a place where the examiners, our forensic examiners, they would actually upload their information. Like when they put the letter, which I'll show you one in a second, they had input their letter and any other case information they wanted to send back to APS. But they also put document request in there. So if they had a specific request for certain documents, they would put it in there, and APS could go and draw that down, go get those documents. And we also use this portal as a way to have communication back and forth, right? So it's a closed system, HIPAA compliant. We put a message in, APS could see it, Eide Bailey could see it, everybody could see those sort of messages, so we could all be following up on this. And then we have pages where you know, we'll click on, this is a forensic accounting analysis, that sort of thing, just sort of some of the basic information. We also were able to collect sort of provider time, as Angela mentioned. You know, we were looking for that 28-day turnaround. As you see here, this is, you know, could be 45 hours that forensic accountants work on these cases. Sometimes it's a lot less. It ranges, right, in time that they have to spend because of the range of complexity. And one of the other things that we were able to collect, and we had in the system, is the amount of questionable dollars in each case. You know, one of the things that we run into a lot of times is trying to figure out, okay, how much is actually potentially exploited? Those data don't exist very readily anywhere, at least from what I could find. So what we want to do is we wanted to try to get a tally of what does that look like when they're doing these cases? How much are they actually seeing and going, uh-oh, we don't have a good reason why this money and this amount of money was spent, which starts raising awareness, right? If you see up $500,000 is questionable, that's probably going to get people's attention, right? So we want to start getting an idea of what that is. And why we say questionable is, you know, one of the things we when we talked with IBA, like, hey, can you tell us, you know, is this amount that's missing? Is this amount where that was exploited? And they said, well, we can't say that because we don't, they don't get to do that in these cases. They didn't do interviews with the client. If they were able to do interviews, those forensic interviews with them in person or over the telephone, those sorts of things, they can make more definitive legal determinations. But because they weren't doing that here, they'd have to say this is the questionable amount. So that's the language they had to use for this project. And as you see here, when they get done with the case, they would upload their letter, they would upload any other work papers, those sorts of things. And this was this is a type of letter that would get uploaded. They would provide some basic information. They talk about, you know, when the allegation was made. They would talk about the amount of money that was questionable, you know, that sort of thing. And they would upload that into that along with whatever their findings are into the APS portal for APS to have to make their determination. So let's review some of the preliminary data from this approach, and we'll go through some case characteristics, some case statistics, some client satisfaction questionnaire results, because remember, we're interested in making sure that everybody was happy with what we were doing. And if they weren't happy, we want to understand why they weren't happy so we could figure out if there's a process to address it. And then we'll talk about some of the APS data determination. In terms of, you know, this is a table that is published in the Journal of Elder Abuse and Neglect, and you know, we published this paper, these preliminary findings of this study and this program in Journal of Elder Abuse and Neglect. So when we published it, we had about 77 cases that were collaboratively worked through with APS and the forensic accountants. On average, they were, you know, close to 80 years of age for the survivors. And then, you know, most were female, most were Caucasian. The living status, most of them were living with others, which makes sense, right? You got somebody there probably taking your money. A lot of it's happening by family. And in terms of allegations, most of them, 66.2%, were financial exploitation only. But we did see that, you know, some had self-neglect, and some other ones, a lower percentage, had financial exploitation plus other types other than self-neglect. But when we look at client possible risk factors, you know, the other person has access to client's finances. That was about, you know, 45% of the cases. There was, you know, 37, almost 38% of the clients had some sort of indication, potential Alzheimer's disease, dementia, cognitive decline. There's a lot of dependence on others for financial management. So you can see how these things make sense as risk factors for being exploited. You know, physical disability, but then also others. And we've seen this when somebody's dependent on you for your money, right? It may be more likely that they misuse that money. And so we were seeing some of that as well. So those are some of the client characteristics and case characteristics. In terms of things that Bailey, you know, their process, what they reported out on is, you know, in terms of the number of months of records reviewed to date, they reviewed about 1,700 months worth of records. On average, for each case is about 22 months per case. of records. So you're talking, that's a lot of years. So that's a lot of data to look at. On average, the number of bank accounts was about 4 bank accounts per case. And then the mean amount of money that they were tracking in a case was about 91,000. Standard deviation was quite big because sometimes you had a low amount, but then sometimes you had these max amounts where they're looking at over $700,000 in a single person's case, right? Number of credit card accounts, on average 1. So these, it wasn't a whole lot of credit card transactions happening, but and when they did, it was a little bit lower, but they did have a max. They had one big one that was about $107,000 on credit cards. That's insane, right? That's a lot of credit card debt. Investment accounts were very few. They we had about 47 of them. So I mean, I wouldn't say very few. It's just that on average, it was some people had more than others, right? As you might expect, but they didn't have a ton of them. And we're dealing with people that may not have a whole lot of money. And this isn't one of those things just happens to people with money, right? That's one of the misconceptions. A lot of it happens in folks that just don't have a whole lot of money. It just happens for a long time, and they end up losing a lot of money. And so some of the investment accounts, about 21,000 per is what they looked at, and then max was 865,000. But total number of transactions reviewed was over 100,000, and then total amount of transactions reviewed was, a lot of money, right? And then you look at the amount of questionable activity was over $8 million in these 77 cases. So when they're looking at these, our forensic accountants said, you know what, reviewing these, there's about $8 million that we're not certain about, that we think needs further investigation. And then when we looked at it, we asked about satisfaction with the collaboration, which, as I mentioned, is very important for this sort of thing. It's one thing if you put these collaborations together, you want everybody to be happy and work together and keep working together. If it's something that could be beneficial for these older adults, these people that are a little bit vulnerable. And what we found is, forensic accountants, they really enjoyed working with APS. They enjoyed these cases. The SMEs were really happy with these this collaboration. Caseworkers, majority overall, really happy. You see some dips in the percentage here and there, but I mean, nothing got below 90%. So majority were happy. The major point of, hey, I wish this could be better, was the amount of time that it takes on these cases. And that doesn't reflect on forensic accountants not doing what they need to do. That doesn't reflect on APS. That reflects on the complexity. Again, we go back to the complexity, and that's why we got to have these sort of programs, because what we would find is APS will do their due diligence. We set up, did the FEIST, they did all this really great work up front, and they sent it over. Bailey gets in there. They're the experts. They're the ones who can go, we don't know what this account is. We don't know what this account is. And then they would have to go back and say, hey, we found extra accounts. Can you go get me information on those accounts? Can you also give me a little bit of information about those accounts, maybe from the person? So it required a little bit more investigation on APS's side to go try to get the information, which delays the case, right? And the determination, or the information comes back from Bailey. And that's just because you want it to be comprehensive. You don't want to give a determination and then have to give a whole different one. So we try to make those determinations based on the full amount of evidence, which means sometimes there's a back and forth, and sometimes it takes a while, right? You ask for more information, APS just can't walk up. I mean, they can call the banks, say, hey, we need this information. The banks may be like, yeah, sure you do, and we'll get it to you. And then who knows when they get it to you. I mean, so those sort of delays were some of the big parts of why there may be a little bit less satisfaction. But overall, everybody was really happy with the collaboration. And so, like I said, the challenge is this is the major challenge: time it takes to examine records and summarize findings. And that even in cases where they didn't have to go back and ask for information, some of them are just really complex and they take a while. and that's just the way it is. And as I mentioned, discovery of new information was needed. And another thing that makes one of these sort of programs challenging in terms of sustainability, that sort of thing, is good and thorough work in the forensic accounting world isn't cheap. I mean, good work just isn't cheap. And so that was, that's one of the things that I think anybody's going to run into. Like, okay, how do we fund this? And so a great thing about trying what Angela and her team set up front was, if we know this is a really good resource and we know it might be a little bit expensive, what we got to do is figure out how do we get the right cases to Eid Bailey, so that we're not just sending them a bunch of cases that we could have potentially worked on our own. So within Texas APS, you've got the caseworkers and the SMEs, then you've got these new financial exploitation case units that are there to handle some of the little more complicated ones, but then you got the ones that they say, hey, we need more help. And so it's those cases that are being sent out to the forensic accountants, which helps offset some of that potential cost and challenge to sustainability. And then in terms of next steps for this program, great thing is we got finished at the outset. One of the awesome things about working with Texas APS, and I keep tooting their horn because I mean it's a great program, and they're always looking forward to, okay, if this helps, then we want to figure out how to maintain it. And that was always the vision from the very beginning. If this works, we can do it. How do we sustain it? And so after we did all this, we kept it going with Eid Bailey, and then now I think it's moved over to a different company, but that resource now is a resource that is available to Texas APS. Forensic accounts are now available as a resource through the process that we've all been able to develop. We've pulled out, we don't have the middle agency anymore, like UT Health. We don't have to be that liaison. Now it's an APS to the forensic accountants, because we've already figured out that process that works. And so that's a great thing. And so that's now helping Texas APS clients around the state and APS workers. Now, in terms of next steps, remember I mentioned that step where we wanted to figure out how to get better evidence to the DAs, to the law enforcement, and we weren't able to get to that. We started to do it, then we realized that it was just, if whatever we did was going to be too small, too limited to make a really good sort of case, and so we weren't able to get to do it any justice. But now, good thing is we've got, we've been doing work with the Johnny Hartford Foundation for a long time, and we've got a community of practice. Now we do this mentoring program, and a lot of Texas APS workers are, and staff applied to be part of this mentoring program to learn more. And so we've built out this community practice just in the state of Texas with APS workers. And now what we've done is we've decided on a project to try to, and they've chose it to improve financial exploitation work. And what they've decided was, hey, we want to figure out how to maximize the information. So now we've come back to this actual part of what we couldn't get to, and we're trying to figure it out with APS, myself, and then some other folks, some other law enforcement agencies around the state in different, rural, urban, to try to figure out, can we present them with better evidence, better information in the ways they want to see it. In terms of implications for the future, we've got the enhanced financial exploitation training for APS staff at different levels, caseworkers, then you've got the SMEs, that sort of thing. We've got these new APS financial exploitation units that are in place. Those are great. And then, as I mentioned, we now have this program that's in place, and we're trying to figure out, okay, now when we have this information, how do we get it to the law enforcement in a little better way? So some takeaway points, there were enhancements that could be made. And so we worked on making those enhancements, and we think we did, and we put together some good training. It's feasible to do this work, and actually, everybody doing the work together, it worked out. People enjoy it, they like it. And it seems to benefit everyone, and hopefully it benefits the client. One thing we didn't see is that the 36%, you know, that sort of unable to determine rate. We didn't see that move a whole lot, and so we're still trying to figure out why that may be. Because you know, you got forensic accountants working with APS and we expected to see it move, but just didn't, and so we're still trying to figure that out. I don't think it's because of I don't think it's because we didn't have better information, better, you know, investigations, that sort of thing. I just think it may come down to, is it enough, right? Like it's still, when you're just providing questionable information, is that enough to make somebody go, okay, I'm gonna validate this? And so there's still some room for trying to understand that out of what we've done. So and you know, I think we've shown that we can sustain this long term, and APS has picked it up as a resource for their staff and their older adults. So with that, I'll stop there. I'll say thank you and open it up for questions.
Yeah,
I don't know how
so
much time we have. We got 4 minutes.
it's all good. Thank you both so much. That was really good. I'm just gonna hop into the questions. LaShonda asked, will we have access to the FEIST tool?
The FEIST?
Yeah.
This tool, I can reach out to my person who replaced me, and her name is Amanda Schuler. She's now the Director of Policy and Performance with Texas APS. And I can send Esther her contact information so she can get with anybody who wants to learn more about the FEIST.
Yeah, and you can get to the FEIST if you Google the FEIST, you can get the full form. I mean, that's what we did. We
The
found
original or the Texas?
the original. I'm just
The original. Okay.
Yeah.
Okay. Well, there you go. So just you can
Well,
get
we
the
can also-
original.
Yeah. I was saying we could also potentially give them the modification in case they wanted to use the modification. So we'll work on that too.
I'm on mute. If that's something that is okay with you guys to post on our website with the recording, you can let me know after this. So let's see. So for the people that asked about access to the training and PowerPoint, the recording will be posted on the website. If it's okay with the presenters, we'll also share the slides. And Jamie asked, can we access this portal? And can we have a contact info for you in order to follow up if we have questions?
You can follow up. Yeah, you can follow up with us if you have any questions. You cannot access the FACN portal. That's a proprietary thing. It's a closed system with APS client information, and so APS owns that. That's all protected information within that portal. Now, if y'all decided wherever you're at, if y'all decided y'all wanted to do something like that, we would happily talk to you and help you sort of get that sort of portal set up if it's something you wanted to do.
And LaShonda asked, is the Eid Bailey case statistic nationwide?
Which statistic?
I think the question came up when you were reviewing the results.
Oh, no, those are just specific to Texas APS, some Texas APS clients that were part of this project.
And LaDonna asks, is there a evidence collection and protocol tool available?
So we did do training with the staff on the types of information they were to collect because, you know, cases can vary from case to case on what is going to need to be collected, but that is one of the things that they can use the FEIST tool to help guide them on different items that may be something they need to collect.
Angela, do you think are these trainings things that Texas APS may be willing to share with others? May have Texas statute codes and stuff like that, but might be helpful to other people.
Like I said, I can reach out to Amanda Schuler and talk to her and see if that's something they can do.
Now that Kez is head of NAPSA, we'll put it,
That is true.
put the pressure on.
Kez, my old boss, he's over the whole program, so we could just get him.
There's just one last question. Are you able to track any changes in frequency of impact on the victims, such as suicide rates?
We didn't track those. I think it would be an interesting. That's definitely an interesting thing to look at. I think, what we were trying to do is just sort of let's figure out how to get this in place. Let's do it. Let's refine it, and then now I think something like that would be a really feasible thing to do, and maybe a good next step. Say, hey, while we're working these cases together now, we've developed this process. Let's look at some of these sort of health outcomes.
Okay. All right, that's just one more question. Sorry if you have the time, but Crystal said, how does Texas get the banks to cooperate with investigations?
So I saw that pop up. So in Texas, we have a statute that requires banks, medical professionals to cooperate with APS. If we request any records, whether it be medical, financial, psychosocial records, anything like that, we have statutory authority to access those. And if they decline to provide them, then we can go to court and get a court ordered for access to the records. Typically, they do cooperate with us, and they have their own statute that says that they are responsible for reporting whenever they suspect financial exploitation. But as you probably all know, and Jason mentioned, it can be hard. Sometimes they'll say, yeah, we'll get you those records. And 2 weeks later, 3 weeks later, you're still following up. So it's tricky sometimes. But yes, statutory requirements make it where it's a little easier for us to say, hey, we have the right to these records.
All right, well, thank you all, and thank you to Angela and Jason. This was really great. If anyone has any questions or would like to learn more about R2P, I've included the link in the chat. I hope you all have a great day.
You.
Bye.